Good afternoon to all. This is Parul Batre. I am your community teacher, and from today onwards, we are going to start community health nursing subject. So, in my community health nursing subject, first chapter is healthcare delivery system in India. Whatever the healthcare delivery is there on that one system is there, on that health minister and state health minister, all the persons will be there. So we will learn about whatever the levels and how the healthcare policies will be delivered to the each and individual into the community. Today we will see in this chapter. On that introduction, we will see what is health. So as we can say, health is as we all knows that health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity, according to WHO. All of you know that the definition and the types of health. So health, they are having four types: physical, mental, social and spiritual health. And then coming back to our topic, we will see the definition of healthcare delivery system in India. So on that, as you can read, it implies, or healthcare delivery system implies the organization, delivery, staffing, regulation and quality control of healthcare services. So healthcare delivery system in India, they will make, or they will imply the organization. They will make one organization, they will deliver quality health services, or they will regulate the policies. They will make one staffing pattern, or they will make made staff to regulate that policy, and they will the staff will regulate all the policies, and after that the healthcare services will be provided to each and individual in the community. So this definition is according to J.E. Park. So now next, after that, healthcare delivery system. What is the need, what is the objective of healthcare delivery system in India? Then after that, after definition, we will see what all are the objectives. So objectives, first objective is to improve the health status of population. After making policies, making staff, they will regulate all these things. So what we will get, okay, what is their objective? To improve the health status of population. Whatever the health status is present right now, they, after making policies, they will improve that. They, after delivering the health services, they will improve the health status of each and every population, or each and every single person in the community. So second objective, we will see to improve the experience of care. So whatever the experience they got previously, now after improving that health status, they will improve the experience of care also. Then third one, to reduce the economic burden of illness. Then after getting all these illness or diseases in the community, like right now, whatever the right now season is for corona, so everybody is having economic burden. So after removing this illness condition, the economic burden is will be reduced. If the corona will go, then everybody is having burden or economic burden on the so each and individual is facing economic burden. If that illness condition will go after, or corona will go, every that economic burden will be reduced. So after implying the policies, after giving the care, that will reduce the economic burden of illness. And then last not the least objective is to improve the social justice equity. Okay, then these four are the objectives. So on that, first one is to improve the health status of population, second one to improve the experience of care, then third one to reduce the economic burden of illness, then fourth one will be to improve social justice, equity. Then after this we will see the what all are the characteristics of the healthcare delivery system in India. On that, first one will be orientation towards health. So first characteristics will be they will orient towards the health. Whatever the health status be present in present condition, they will first orient the health status. Then second one, then population. After they will orient the health status of the individual, then they will take the population perspective towards present problem present into the community. Okay. Third one, intensive use of information. Whatever the information they will gather, they will orient to the orient of health of each and every individual. Then second, they will take the perspective, okay, of population. Third, they will intensive use of information. Whatever perspective or information they will take from every individual, then they will use that information to making policy or making legislation or to make the goal. Then fourth one, then focus on consumer. They will focus on consumer, those person they really need to improve the health status. They will then they will focus on consumer, those who really need to improve their health. Then fifth one, knowledge of treatment outcome. What after they first they orient the health, what is the recent problem, then they will take the population perspective. Then third one, they will gather information, then they will focus whatever problem is present, then they will focus on consumer to give the health healthcare. Then after that, knowledge of treatment outcome. Whatever treatment they got, they will take the knowledge, what is the outcome after giving the treatment, what is the consumer outcome to the to the healthcare service provider. Then constraint resources, they will constrain the resources, whatever the resources will be there, they will constrain it. Then coordination, whatever the resources they have constraint, then they will make one coordination between these resources. Okay. And then next one, reconsideration of human values. Then they will reconsider the human value, whatever the human value, they will give more attention to that particular part. Then they will expect next one is expectation and accountability. Whatever the person or the each and individual of this society is expecting, they will try to fulfill, and they whatever the they are providing services, that should be accountable, or accountability they will maintain. Then next one is next characteristic is growing interdependence. Whatever the interdependence, whatever the resources will be there, or they will maintain one channel or into the society, and they will grow the interdependence into the society or community. So these all are the characteristics. Orientation toward health, then after orienting, then they will make one population perspective. Then after that, intensive use of information, they will gather information. Then whatever information they will gathered, then they will focus on consumer, what they need, what kind of healthcare services they need. Then they will knowledge of treatment, or whatever the treatment they have got, they will take the knowledge and they will take the outcome. Then they will constant resources, then they will, whatever the resources they have got, they will maintain, they will coordinate the resources, then they will reconstruct the human value, then they will fulfill the expectation of accountability, then they will grow interdependence. Then after this, up to now you may be understood. Then after that, organization, the healthcare organization in India, on that organization we will see the levels. There are 3 levels. Okay, as you all know, in India one health minister will be there, on that state health minister will be there, and district level also healthcare providers will be there. So on that first one we will see central level. In organization of health services there are 3 levels: central level, state and district level. On that central level is divided into 3 parts: that Ministry of Health and Family Welfare, second one Central Council of Health, third one Director General of Health Services, means DGHS. On that central level, first we will see Union Ministry of Health and Family Welfare. Okay, so Union Ministry of Health, on that we will see the staffing pattern, means what all are the person who those they will regulate all the policies. Okay, so first in the department Union Ministry of Health and Family Welfare, on that Department of Health, and there are 2 department on that, Department of Health and Department of Family Welfare. On that Department of Health, what all are the persons, authoritative person are present. On that first one is secretary, second under the secretary joint secretary will be there, and then under the joint secretary deputy secretary will be there, and after that administrative staffs will be there on the Department of Health. Now we will see the Department of Family Welfare. On Department of Family Welfare there will be a secretary will be present, under secretary additional secretary will be present, after additional secretary commissioner will be there, and under commissioner joint secretary will be there. So this is Union Ministry of Health and Family Welfare. On that 2 department will be there, Department of Health and Department of Family Welfare. Then second, first we have seen Union Ministry of Health and Family Welfare, then Central Council of Health. So first we will see when Central Council of Health is developed. It was set up by a presidential order on 9th of August 1952 under the article of 263 of Indian Constitution. It is set up by presidential order, and it is made in 9th of August 1952 under the article of Indian Constitution 263. On that Central Council of Health, there are 2 persons will be there. Chairman means there in every council one chairman will be there. The chairman will be Union Health Minister or Health Minister of India. On that under the Health Minister of India, there will be so many members will be there. On that members, each and every state of India, whatever the health minister are there, they will come under the Union Minister of Health, the Union Health Minister of India. Under that, all the state health minister will come. Like on government, for example, government of India, one health minister is there. In government of India, one health minister is there. Under the health minister, all the state health minister will come under Indian health minister. Understood? Then what is the function? We will see the function of Central Council of Health. So first, what is the function? So first one, consider and recommend board outline of the policy. The Health Minister of India, they will consider and recommend broad outline of the policy. They will make one policy, and they will give the outline how to make policy. Then they will, after the outline making the borderline of the policy, they will make one proposal of legislation in the field of medical and health. After the making the policy, health policies, there are several health policies are present. To how they made? So first the broad outline they made, then after that they made one proposal. then proposal of legislation in the field of medical and medical and public health. Then after making the proposal of legislation, they establish one organization. Okay, they made one broad line outline of the policy. Then they made one proposal. After making the proposal of legislation, what they will do, they will establish one organization to maintain cooperation between central and state. They will make one organization. Whatever the policies they made, it's they are regulating, they are giving delivery health services accordingly or not. Then after that, they will fourth function is regulation regarding distribution of available aids and health for health purposes. So recommendation regarding distribution of health. So after making the organization, what they will deliver, the whatever the health aids have for improvement of health, they will deliver to the organization will deliver to each and every individual. So what all are the functions? So first one will be consider and recommend board outline of the policy. After making policy, they will make one proposal of legislation in the field of medical and public health. After that, they will make after making proposal, they will make or establish one organization to maintain the cooperation between central and state health department. Then after that, they will recommend regarding distribution of available aids for health purposes. These all are the four functions of this. After that, last one is the Director General of Health Services or DGHS. DGHS, in that three persons are there: administration, public health and medical care, or medical care, public health and administration. So deputy DGHS medical care, under that nursing advisor will come. After nursing advisor, deputy nursing advisor will come. Okay, DGHS will make healthcare services rules, and nursing advisor and deputy nursing advisor, they will carry forward it. And there are three persons. So as you can see, DGHS, under DGHS, deputy DGHS medical care, deputy DGHS public health care, then deputy DGHS general administration is present. For deputy DGHS medical care, under that nursing advisor will come, and nursing advisor, under nursing advisor, deputy nursing advisor will come. These all are the staffing pattern of DGHS health services. After that, we will see the function. What is the function of DGHS? Means Director General of Health Services. What is the function? So on that, one is specific function, one is general function. So in the general function, they will survey, they will plan, they will coordinate, they will program, and the appraisal of health matters. So first, in general, first one will be survey. They will do survey in the community, then they will gather information. Okay, then they will plan according to survey, then they will coordinate between district level and central level, then they will make program for according to the condition in the community. Then appraisal of health matters, they will make appraisal of all health matters. Then on the, this is the general function, means first one is survey, second is planning, third one coordination, fourth one programming, and fifth one is appraisal of all health matters. Then specific function. What is the specific function of DGHS? On that, first is international health relation, state to the central, and the central health minister, they will make health relationship between national and international level. Then second one is control of drug standard. Whatever the drug malfunctions and whatever the drugs which is harmful for the health, they will maintain and they will control the drug standard. They will provide the standardized drugs to the individual. Then they will medical third one, the specific function of DGHS is, third one is medical store depots. They will see, look forward the medical store reports. Then fourth one, postgraduate training. They will give postgraduate training to healthcare providers. Then medical education, they will open the several or various government health institute medical to provide the medical education and to improve the medical education of the each and every individual. Then after getting in education, whatever the problem is present into the community or in the society, through research only we can find out. So next, what is the specific function is to medical, to do the medical research. So there are several research organization present into the India. They will research about the community health problem or health problem in India, whatever is present, they will do the researches. Then central government health scheme, they will regulate, DGHS will regulate or they will make central government health scheme for each and every individual. They will provide up to each and every individual central government health scheme. Next one, national health program. Whatever the health program is present, they will send to the each and every individual. They will get to know, they will make aware people about national health program. Then DGHS next work is or next function is Central Health Education Bureau. They will maintain, as I said already, कि they will regulate they will govern the healthcare education institute, so to give education to the healthcare providers. Then next one, health intelligence. After that, national medical library, they will make several library to educate each and every individual.